welcome to another episode of PHAMCAST. And boy, is this one absolutely fantastic. We've just got this wonderful human being here who has such a compelling story, and we can't wait to have you hear everything amazing that she has to say. We're crossing borders with the beauty of virtual Zoom style
Connections.
connections. Yes, it's amazing. So,
and you know what, Meg? What I love about what we're doing here at PHAMCAST is that we're really empowering people to be the CEO of their health.
Mm-hmm.
And when we started Preventative Health Awareness Month and Movement, it really was meant for Canada, but the rippling effect now is global. And
Absolutely.
It's because of amazing people like Mandi Dickey that's making that happen. So without further ado,
yes,
you're going to get to start an introduction.
Yes.
And I'm going to sort of finish it off, and then we're going to dive in because we cannot wait to introduce this incredible practitioner to you and let you hear her story. It's very inspiring.
Yes, absolutely. Fascinating world of neurology. So I can't wait to dig in and hear all of these wonderful things we're going to talk about. So Mandi Dickey is a board certified nurse practitioner with 25 years of experience in healthcare. She's a 3-time Top Nurse Practitioner Award winner, received the Faculty Excellence Award in her previous role of nursing professor, and has been on the review committee for several nursing textbooks, and was the recipient of the Women of Armor Personal Growth Award for 2023. Wow.
Yeah, and in 2022, Mandi wanted to share her knowledge beyond the walls of her work facility and began her own podcast called Brain Wellness, the Podcast, covering a multitude of topics related to brain health and wellness, and has been interviewed on many other podcasts discussing migraine and stroke treatment and concussion prevention. I was honored to be a guest on her podcast just last week, so make sure you check that out. In 2023, Mandi was in a car accident and suffered a traumatic brain injury, and while not fully recovered, has returned to her passion of sharing and educating the public about neuroscience topics, now most passionately about concussion and traumatic brain injury. Welcome to the show, Mandi.
Yes, welcome.
Thank you, ladies. So glad to be here.
You know, we've had many discussions and an entire hour podcast together, and I learn something new every time I talk to you. But one of the things that has been consistent in every single conversation is your passion and commitment to really not only helping yourself, but helping others. You really are a servant leader. And it's really, I just want to really let our listeners and viewers know that it takes a lot of courage when you're experiencing your own pain through a traumatic brain injury to still take to the mic and share your story so authentically and rawly so that you can help others. And that's exactly what you're doing. So what we'd love to know first off is tell us a little bit about your history as a nurse practitioner in neurology and what that was like for you, because I know when that fateful event happened and you had that injury, that car accident, it's completely changed your lens. So tell us a bit about your backstory.
Yeah. So I got into healthcare initially, not entirely sure where I wanted to go, but it didn't take me long to figure out that the neurology department was where my heart was. I ended up floating to that unit as a nursing assistant, even before I became a nurse. And I just fell in love. It was no 2 patients were the same. So you could have 2 patients next to each other, same diagnosis, same stroke if they're 2 stroke patients, and their brains responded differently. So it was so exciting seeing that transition and just seeing how people were different. So over the years, I worked as a bedside nurse, I worked in management, I worked as a nursing professor. And then I really, really missed being at the bedside when I was doing my nursing professor role. Went back to school for nurse practitioner. So I got my nurse practitioner in 2012. And I knew exactly what I wanted to do. I talked to people in the field and knew exactly the degree I needed to get to land in neurology. So when I got there, that's where I wanted to be. I was there, and I worked in both the hospital and the clinic for many years. And then the last few years has just been the hospital. And in 2023, I took it a step farther, and I wanted to get a little bit more expertise in there and added the neurosurgery part. So I started with a surgical group doing brain and spine surgery. And I was so excited to do this. The day of the accident, actually, I got to see a brain surgery, which was something that I had wanted to see the entire time of my healthcare experience. So 24 years up to that point. So I got to go from watching brain surgery, watching this tumor being removed and this person's life being changed, to being in a car accident that night and having the rug pulled out from underneath me. I thought I was the expert. the whole time. I thought I had learned so much in all of my years. I had worked with some phenomenal physicians who trained me, and I thought that I was kind of the top. And being on the other side of this has opened my eyes so much to make me realize that I didn't know what I didn't know before. And those gaps in there is what's fueled this passion for where I want to go moving forward.
That's great. It's really the perspective of it, it's actually a gift because you have this really broad perspective from both sides of it now. So you've got, your professional side, and now you've been through it yourself. So it's going to give you just that a little bit more of an edge when you're handling certain things. You're going to be able to bring this perspective that might be missing for a lot of healthcare providers because you've also been on the patient side. So that's actually quite amazing.
Yeah, I was actually talking to my kids about that the other night because we were talking about how bad things happen and why do bad things happen. And I said, even when something bad happens, it doesn't have to mean it's a bad thing, because the car accident was a bad thing. It's changed our entire world. But had I not had that experience, I wouldn't have seen the things that I have in this last year that make me want to make the world a better place. So I wouldn't have learned the lessons that I now get to share with people.
That gave me some chills there. That's
and this is why, Meg,
Yeah.
when I was telling you about Mandi, that
Yeah.
I was drawn to her because our stories, although different, my own history with my health and what drew me to this career that I've had in preventative and integrative medicine. When you've experienced something firsthand, and as Megan said, I didn't know it at the time, but it truly was a gift. And it continues to be as we grow and open our eyes and our lens in a different way. Now that you are in this position where you're in recovery mode, because you're still not back to work, correct?
Right.
How are you doing?
As a nurse practitioner.
Yeah, how are you doing? Let's get an update
Mhm.
really about how you are right now.
Yeah. Oh my gosh. In the last month or two, things have been changing rapidly. So the first 6 months, I really didn't notice much change at all. And then that's where the whole red light thing came in that we can talk about more. Started getting into the complementary therapies that weren't there in the first 6 months. So I saw really no change. I struggled with word finding. I couldn't come up with conversations. I would stop in the middle of a sentence and not being able to come up with my words. Thankfully, I had 6 months of podcast interviews recorded. So I had a backup. So while I was trying to recover and get back to being able to speak, I had that there. So there was no break for my listeners. But when I finally got back into it, it was because of doing complementary therapies that got me better to the point where I could speak again. But my memory has still not kind of picked up where I needed to be. So there was a good chunk of time there that my medical knowledge really was nowhere to be found. People could ask me questions and I couldn't come up with the answer. I couldn't think of where things were in the body. I've taught anatomy for 20 years and I couldn't remember where things were. And so I knew that there was no chance that I'd be getting back to the bedtime anytime real soon because of that. But beyond that, I used to go through a day where I'd see 14 patients in the hospital. I could review all of their charts, know their history, go in and talk to them, get all those conversation, the assessment pieces, and then go sit down and write my notes because I remembered it all. And there's no way that I could do one patient like that right now. So my cognition is still not quite there. The conversations are a whole lot better. Everybody keeps telling me that I sound better every day. So the conversation part is definitely there. And I can speak to experiences that I had in the past. Don't ask me much about this last year because there's still a lot of that I just don't recall. And every day I will have conversations with my kids that I repeat myself. So I sometimes joke that I'm the Alzheimer's patient in the house right now because I'm a little bit right there. But every day is a little bit better. Still working on being able to tolerate long periods of time doing any activity, which has also kept me from getting back into work. So there's still things to work on, but I'm definitely better than I was.
And is that because of fatigue, Mandi? Like you find that you fatigue easy? I'm just, for our viewers and listeners, I think sometimes in healthcare we take for granted that people understand when they sustain a traumatic brain injury, a concussion or a stroke, really what to expect and the cascading of symptoms that can occur that they don't connect the dots with. So can you give us some of those ideas? I mean, you talked about cognition and memory and not being able to remember things that you've known for long, and fatigue. Are there things that would surprise people? They might not surprise you as a nurse practitioner because you worked in that field, but to the average person, what are some of the things that they can expect when you have a brain injury?
Yeah, the list is huge.
Yes.
And I gave a presentation actually to some other TBI survivors earlier this year and had a whole slide dedicated just to the symptoms. And the list is kind of endless. I've had issues with balance, double vision. I have prism glasses now so to correct the double vision. Fatigue is not just fatigue in the sense of being tired. It's mental fatigue. So anytime I'm taxed and I have to use my brain for any period of time, I stop being able to word, as I call it. I'm like, I can't word anymore because I can't come up with the words that I want to say. I'll struggle in conversation. And I've never been that person to struggle in words. So even that little thing, people don't always notice it when they're not with me all the time. And even people in my household don't always notice it because I speak slower now and more intentionally than I used to. I used to ramble on really, really fast. And now I'm more thoughtful in my words because I don't want to stop and sound like I'm pausing. Rather, I just kind of continue on with the conversation like it's normally happening, but it's a slower pace than it used to.
Oh my gosh,
Um, so that, and headaches. Headaches are definitely there. When I get that mental fatigue, the headache kicks in, and then the headache kind of takes over everything. Balance and dizziness kick in when I'm tired. I call it hitting my wall.
Okay.
So when I've hit my wall, whether it's an emotional wall, physical stress, whatever it might be, I hit that wall and those symptoms come rushing in. And if I don't catch it, then it's a problem. The problem is I don't catch it. My husband has gotten really good. If he's there and he's paying attention, he can catch it as it's starting to show up. But if he's not there with me, I will hit that wall and just keep going right past it. And then I'm done for the next couple of days.
Right. And that's, to be able to even articulate that. And thanks for sharing that, because I do think there's a lot of people that are experiencing symptoms and they take for granted, oh, I just had a concussion. And they don't really understand how much impact it can have on the brain and our overall system, which speaks to this whole thing called integrative health, which has always been, I've never understood how we could possibly segment conversation and healthcare with, neurology and gastroenterology and psychology and all because it's all connected. And when we're talking about the brain and the nervous system, I mean, it is essential for absolutely positively everything we do, endocrine-wise, hormonal-wise. So thank you for sharing that, because I think that might put a light bulb on for some of our listeners and viewers that might just be pushing through thinking, there's nothing wrong.
Exactly. But I also want to add that the way you're articulating yourself, you're expressing a resilience, you're expressing a sense of finding your own path and a new normal. Like when I look at you, and not that brain injury has a face, but you would not realize that you had experienced this trauma as a new person meeting you. And I think that probably there's a couple of things where in the background you're feeling like, oh, I have to act this way or I have to be this way, and that's where the fatigue will come in. But also just, going about your day and just trying to feel quote unquote normal, right? I would just never have known that you were experiencing this. Excuse me. Go ahead.
Yeah. And as a mother, I can't even imagine, Mandi, can you speak to that? Just, we're both mothers and it's the toughest job and the most important job on the planet to begin with. How has that been, managing motherhood, both from the perspective of having to mother, but you alluded to it, but also showing the way for your children to not be scared, to recognize things in mom and to respect the process, because God forbid they may too, they should be honoring their own bodies. And so you're leading by example. How's that been for you?
It's been tough, to say the least. Last summer, like I said, I don't really remember much about it. I felt like a very absentee parent because I was stuck literally in a dark room under blankets, under hats, whatever I needed to be, and had to have the kids quiet and on electronic devices, probably much more than I ever would have let them before, because I needed quiet and any overstimulation was too much. And I couldn't tolerate being around my kids. And I love my children. There's a reason I had them.
Yeah.
So that was really, really hard. And even as they got into school, it was a little better because then I could take naps while they were at school. So they didn't necessarily see me taking the naps and it didn't interfere. So, because when they got home from school, then we could spend a little bit of time together before I kind of hit a wall again. But they've also gotten really good at hitting the wall and being respectful. I think we've just been very open in our family. So we talk about everything. We talk about mental health. We talk about physical health. Everything is just normal everyday activities in our life. So we always talk about those things and we talk about our feelings. So when I'm feeling overwhelmed or feeling big feelings, we talk about that a lot. My youngest child has autism, so we deal with big feelings a lot. And I've kind of joked that this has almost made me a little bit more empathetic toward him as well, because
Yes.
I now have some of those characteristics that I
Yeah.
see in my autistic child. I need structure. I get overwhelmed. I get the hypersensitivities are there, and I've become very black and white, where I used to be able to see things a little bit more kind of hazy. So I've fallen into those characteristics that he has, which helps me understand him. So he understands me a little bit too. He's like, yeah, mom, I get that too. And
Aw.
I think just that openness in our household to begin with kept them being a little bit more open. So when I do explode, because that's another part of TBI, is that anger meter goes up
Yeah.
really, really fast.
Yeah.
And I do explode. I hate when it happens. And then I usually have to go around and apologize to everybody. And they all forgive me because they understand that it's my brain injury and it's not just me. It's not mom. I wouldn't do that normally.
Yeah.
It's so important to
Wow.
share, and that's why I wanted to bring it up. And I know you're going to help just with this conversation. So many mums out there. We've got so much more to talk about. And we're going to take a break here in a moment. In the next segment, we're going to really dive into, what's your message for both other healthcare professionals as well as everyday people, because I know you've got a really important message to share. So stay tuned, because Megan and Mark here at PHAMCAST will be back just after the break, and we cannot wait to have more conversation with Mandi Dickey, board certified nurse practitioner. Stay tuned. We'll be right back.